So this is rectus femoris, and these are the three vasti, the vastus lateralis, vastus medialis, and the vastus intermedius beneath this. So these three vasti and rectus femoris, they continue down as a tendon called the ligamentum patelli, which is attached on the tibial tuberosity here. Now we are going to discuss the anterior compartment of leg. So this muscle here is the tibialis anterior muscle. This is extensor digitorum longus. The extensor tendons we can see on the foot. This is the tendon of extensor hallucis longus muscle. This is peroneus longus muscle. This is peroneus brevis just beneath this. So these are the two muscles of the lateral compartment, peroneus longus and peroneus brevis. This is extensor digitorum longus. This is the tendon of extensor hallucis longus here, and this is tibialis anterior. And this is the extensor retinaculum, the Y-shaped extensor retinaculum, as we can see here. This nerve is the superficial peroneal nerve, which divides into its cutaneous branches on the dorsum of the foot. Now, if we remove this muscle, we can see here the common peroneal nerve dividing into a superficial peroneal and the deep peroneal nerve. This superficial peroneal nerve, it comes on superficially and supplies the anterior and lateral compartment of leg, and the remaining muscles of the anterior compartment, they are supplied by the deep peroneal nerve. And this artery is the anterior tibial artery, which is one of the terminal branches of the popliteal artery, and it is artery of supply of the anterior compartment of leg. And this is anterior tibial artery, which is giving lateral malleolar branches on the lateral malleolus. This muscle in between the tendons of the long extensor digitorum longus is the extensor digitorum brevis, which is inserted into the long extensor tendons. Now coming to the posterior compartment of leg, this muscle is the lateral medial head of gastrocnemius, and this is the lateral head of gastrocnemius. If we remove this gastrocnemius, the muscle that we see beneath this is the soleus muscle. This large muscle is the soleus. So the two heads of gastrocnemius and soleus, they combine and join into the tendocalcaneus muscle, and which is attached on the calcaneum. This is the tendon of plantaris muscle. This is the belly, and this is the tendon of the plantaris muscle. If we remove this gastrocnemius and soleus, we can see this muscle, which is the popliteus muscle here. And then this is the flexor hallucis longus muscle. This one is tibialis posterior, and this is flexor digitorum longus muscle. So these are the muscles, deep muscles of the back of thigh, and these are the superficial muscles of the back of thigh, back of leg, sorry. So the two head of gastrocnemius and the soleus, these are superficial back muscles of leg, and the deep muscles are the flexor hallucis longus, tibialis posterior, and flexor digitorum longus muscles, along with the popliteus, and plantaris was one of the superficial muscles. Now coming here, this was the popliteal artery. It divided into anterior and posterior tibial arteries. So as we are doing the posterior compartment of leg, this one is the posterior tibial artery. It is giving off the inferior lateral genicular and inferior medial genicular arteries. And the popliteal artery here was giving superior medial genicular and superior lateral genicular arteries, these two. And they are taking part in anastomosis around the knee joint. This nerve, which is accompanying the posterior tibial artery, is the tibial nerve. It is the nerve of supply of the posterior compartment of leg, and it is giving